Welcome everyone and happy Social Work Month and happy World Social Work Day. My name is Annette Johns and I'm the Associate Director of Policy and Practice with the Newfoundland and Labrador Association of Social Workers. I have the honor of being the moderator for today's education event, Animal Assisted Interventions, Partnering with Animals in Practice. This webinar is a collaboration between the Newfoundland and Labrador Association of Social Workers and the Canadian Association of Social Workers. We have over 370 social workers from across Canada tuning in to this webinar today in recognition of Social Work Month 2020. It is wonderful that we can come together and celebrate the profession while learning from our social work colleagues. As a country, we're doing what we can to flatten the curve of COVID-19, and these are unprecedented times. Having a webinar where social workers can tune in from their home or in their offices is a great way to obtain CE without having to organize a large gathering. And for those unable to join today, the recording of this session will be added to the NLASW and CASW YouTube channels. The webinar presentation will be approximately 60 minutes, with 30 minutes allotted for questions. Please send in your questions throughout the presentation. Only myself and the presenter will see them. All the housekeeping details you need are included in the housekeeping widget that popped up when you first logged in. Please note that there are several videos that will be played as part of the presentation. If for some reason the video does not play for you, please note that you will be able to see the video in the recorded webinar. I now want to introduce our speaker, Lisa Wade. Lisa is a registered social worker in Newfoundland and Labrador. She has over 25 years' experience working with children, youth, adults, and families in a variety of practice areas including youth protection, child protection, victim services, and mental health and addictions. Lisa received specialized training and education in animal-assisted therapy through the University of Denver's Graduate School of Social Work and the Institute for the Human-Animal Connection in Denver, Colorado. Lisa is also a certified mental health specialist with EGALA, which is the Equine Assisted Growth and Learning Association. Through her private practice, Lisa offers animal-assisted therapy with her dog, Louie. She also offers equine-assisted psychotherapy through her partnership with Adventure Stables in Grand Falls, Windsor, Newfoundland and Labrador. So on that note, I'll now pass things over to Lisa to begin the presentation.
Well, thank you, Annette, and thank you to the Newfoundland Labrador Association of Social Workers. First of all, for showing an interest in this topic, and of course, for asking me to deliver this information to my fellow colleagues, all 370 odd of you. Certainly hope I don't get stage fright. So I also, of course, want to thank the Canadian Association of Social Workers as well for providing this venue for us social workers. I know I certainly enjoy listening in and participating in these webinars myself. So we got a lot of information to get through in this hour and a bit, so I really kind of want to dive right into it. First of all, I just want to mention that the majority of this information does come from my studies at the University of Denver's Graduate School of Social Work. So I basically had, oh my gosh, over a year, 10, 12 months, I believe, I did that course, and I had to sift through like so much information to see what I could fit into an hour and a half. Very challenging, actually, indeed, but I know that I definitely don't have everything there is needed to know about partnering with animals in practice. So I do strongly encourage those of you who are interested in partnering with animals in your practice to, please take a course or a program in this area. You're certainly going to be really glad that you did, and I know that your animal partners and your clients will also thank you as well. So let's look at our agenda. So we're going to be looking at the historical highlights to the human-animal bond, also looking at the human-animal bond in more detail with the benefits of that bond included. We're going to look at the terminology for animal-assisted interventions. We're going to take a little bit more in-depth look at animal-assisted therapy, which of course is going to include your theoretical approaches and some of your standards of practice. As well as ethical considerations, which is very, very important. And that's going to include things like animal welfare, which is one of the most important aspects of the inclusion of animals in practice. You bring an animal into this practice, into this therapy, so you need to know what's the best place for your animal and the best practice for him. So first way of kind of getting through the history of animal-assisted interventions, thought we would do a little bit of a survey. So the question is asking you, what is the earliest well-documented experiment in animal-assisted interventions? So was it A, our first one is the treatment methods for the mentally ill during the late 18th century, so that's 1700s in England, or was it from nursing theory of the late 19th century or the 1800s from nursing theory? What about psychologists' journals and writings from the 1930s to the 1960s? Is it possible that that's the answer? Or was it from research on the effects of pets and human health in the 1970s? So what are your thoughts on this piece? I think that might be a good time. Let's see what your answers are. Well, a bit of a mix mash here, but most of you are thinking that it comes from the research. About 50% of you looking at the research on the effects of pets and human health in the 1970s. Well, you're actually correct, but also it did come from actually the experiments for humans back in the 1700s, actually, the York Retreat, which opened its doors in 1790 in York, England. The picture you actually see here is an oil painting by a patient that was at the facility. His name is George Sidebottom. This was actually an inpatient facility for the mentally ill, and it was very progressive for its time because I know most of you were thinking like I did, you know, mentally ill treatment back in the late 18th century or whatnot was very, very barbaric. But this painting is actually a depiction of the facility by Mr. Sidebottom, and it clearly shows, you know, very progressive treatment methods. You can see, you know, physical activity happening there. There's golf, cricket, football. Also, we have our animal friends. You know, there's 4 dogs that I can see. There's what actually appears to be a little rodent of some sort under the large tree there by the gentleman with the cricket. And I actually read an article about this painting actually that asked for you to find the cat in the painting. Now, it wasn't until recently that I actually spied our feline friend. And I've decided I'm not going to let you know where the kitty is because I'm going to leave that to you for guessing and searching for when you listen to this recorded version of the webinar at a later date because you're so interested in the topic. But the retreat did utilize therapy with animals. It also utilizes art therapy, music therapy, and it actually would be worth your while to read up on this retreat, actually, which is still in operation today in York, England, but it's only an outpatient facility now. So our other choices were all actual events in history as well for the human-animal bond. So we already mentioned the York Retreat, who opened its doors in the 1790s. The founder was actually a gentleman by the name of William Tuke. He started the facility actually after witnessing a family member who was hospitalized for mental illness in the 1700s in England. And Mr. Tuke, of course, felt, as I said before, that the treatment methods of the time were very barbaric, so he opened the York Retreat. Nursing theory. So, of course, nurses practice and learn specific theories, much like we do as well, social workers. And one of those theories comes from Florence Nightingale. And in her text, Notes on Nursing, from the 1880s, she speaks about the benefit of that human-animal bond. And here's a quote actually from her theory, which states that a small pet is often an excellent companion for the sick, for long chronic cases especially. And then, of course, we have Sigmund Freud, our wonderful founder of psychoanalysis. And he made many notes and journal entries about his work with his dog, Jofi. And Jofi was a chow, actually. And that was in the 1930s. Interesting enough, actually, he actually included Jofi in therapy sessions to actually help calm him. But what he began to quickly notice is how Jofi actually was also able to calm his clients. And he wrote extensively about that in his journals. Boris Leveson, who to this day is probably considered one of the founders in the field of animal-assisted interventions. He worked with his dog Jingles in his practice, and he wrote many papers that he actually presented some to the American Psychological Association in the 1960s, and he also wrote several books. And you can still purchase some of these books today. Of course, the biggest validation, and most of you did acknowledge this, 50% of you could see that, it is one of the biggest validations for animal-assisted interventions, did come from those studies on heart disease and blood pressure from the 1970s through to the 1980s. Some notable mentions here are to individuals or researchers like Alan Beck, Aaron Ketcher, along with Erica Friedman and Dean Ketcher. So a lot of what we're going to be talking about today is in relation to the human-animal bond. So although there is not one unified definition of the bond, one that is widely accepted is from the Committee on the Human-Animal Bond from the American Veterinary Medical Association, which states that the human-animal bond is a mutually beneficial and dynamic relationship between people and other animals that is influenced by behaviors that are essential to the health and well-being of both. So it's about relationships, and of course, what's fitting for social work, which is, of course, the profession of building relationships. So there are some specific components to that have been appeared to be agreed on by researchers, and these components actually not only speak to the specific needs of the human, but also the animal. So really keep that in mind, as these aspects definitely need to occur in order for there to be a true bond. So first of all, of course, it needs to be continuous in nature. The animal and the person must have a relationship that's formed over a period of interactions. Bidirectional and voluntary, so the animal and person must be able to choose to be a part of this bond and not forced into it. Here, for the animal, we're going to be focusing on calming signals in your animal partner, which we're going to talk about a little later. But calming signals always need to be considered when judging the animal's interest in the person and the situation. And of course, for the person or for our clients, we need the informed consent, which is very important. The bond, of course, needs to be reciprocal, so both the person and the animal should gain from that experience. And finally, it needs to be persistent. The animal should be able to recognize the human for there to be a true bond, and increased caring is essential to the part of the human component there, as trust is on the animal. So as you can see, all these components need to work together, which creates a bond that is mutually supportive and beneficial for both parties. Not sure why that just flicked to that slide there. But the next slide will show us what this prescription here is. We're going to look at the benefits to this human-animal bond. And this is an ad for a prescription that actually I find works really well, especially for me. So I've had many of those side effects, that's for sure. But as funny as that video may be, which, by the way, comes from the Human-Animal Bond Research Institute, many of the benefits actually spoken in that video are very, very accurate. And for my feline friends, actually, you can visit the Human-Animal Bond Research Institute webpage for your prescription for cat, because that's there as well. I also have a link to that video as well on my Facebook page, and I'll be providing you with my contact info at the end of this presentation, so you can have a look for it there as well. So let's look at some of those benefits, which are indeed based on research. So some of the benefits for child health and development, they include emotional and cognitive development. Examples here are benefits to social competence and self-esteem. Improvements in education, which is specifically related into reading improvements. A reduction in allergies and a boost of immunity to children who actually grow up with pets. Very important research there and interesting facts. And here's a study that I included actually, which again comes from the Human-Animal Bond Research Institute, and it's in relation to autism spectrum disorder. So this study compared children with autism receiving 2 forms of occupational therapy. one with the standard techniques, and one incorporating therapy animals. And the results, of course, suggested that children demonstrated significantly greater use of language and significantly greater social interaction in sessions that incorporated animals in comparison to children in sessions using exclusively standard occupational techniques. So healthy aging, we're going to go across the lifespan here. So a lot of these studies are actually in relation to pet ownership, but some include studies on animal-assisted interactions as well. So there are benefits to physical activity, getting outside, being active, walking the dog, for example, which of course is going to assist with lowering obesity rates and your cardiovascular health. For cancer patients, there's a quality of life and pain management, as well as early detection, where certain dogs actually have been trained to use their olfactory receptors or their sense skills to pick up on cancer early. Some very interesting studies being done in this area for sure, as well as the training piece for these scent dogs. Again, a study here that I included, which speaks to the results of a one-year study that examined the impact of animal-assisted therapy on patients with chronic pain, which demonstrated that, following animal-assisted therapy, patients reported reduced pain, discomfort, and stress. A huge piece of this study, of course, as you see here, it was the additional component that stress among nursing staff was also found to decrease significantly following animal-assisted therapy. Of course, benefits to our mental health. So some studies here on post-traumatic stress disorder and trauma. So in a study of 153 sexually abused children, ages 7 to 17, results indicated that children in the groups that included therapy dogs showed significant decreases in trauma symptoms, which included, of course, anxiety, depression, anger, post-traumatic stress disorder, disassociation, and sexual concerns. And animal-assisted therapy, specifically equine-assisted psychotherapy, has also been found to help at-risk youth overcome trauma and substance abuse. Some research on stress. So positive attitudes towards pets were associated with decreased levels of self-reported stress, salivary cortisol, and systolic blood pressure. Anxiety, patients that received a therapy dog visit also had the greatest decrease from baseline in state anxiety sum score compared with the control groups. So we have control groups in this research. And depression. 2 studies here as an example, but again, you can find many, many more on the Human Animal Bond Research Institute webpage. But again, this is a 10-week study here, animal-assisted therapy program for patients with chronic schizophrenia who showed improvement in mood in comparison with a group without animal-assisted therapy, so another control group here in this study. And another study that showed children with psychiatric disorders showed better intra-emotional balance after only one single session with a therapy dog. So let's take a look at the terminology. So animal-assisted interventions are any intervention that intentionally includes or incorporates animals as a part of a therapeutic or ameliorative process or milieu. Service animals, important to know here, are not included in this category. So animal-assisted interventions, it's an umbrella term that includes many different types of interactions with animals. Those include like animal-assisted activities, animal-assisted therapy, hippotherapy, equine-assisted psychotherapy, equine-assisted learning, therapeutic riding, so many more different types there that this includes. So what we're going to do is we're going to take a look at 2. We're going to look at animal-assisted activities and animal-assisted therapy. So animal-assisted activities, now there are many definitions of animal-assisted activities. But most are based on this definition, which is utilized by Pet Partners, formerly known as the Delta Society. So just so you're aware, Pet Partners actually is one of probably the leaders in the field of animal-assisted interventions, and an organization that many other organizations actually follow. Right now, I think they have actually over, I think it's 10,000 animal therapy teams throughout the United States and some in Canada as well. So if you have an interest in this area, visit their website, which is petpartners.org. They also have webinars on their page. They have online education, just a wealth of information. And of course, they're also on Facebook as well, so you can look them up on Facebook. So again, back to the definition. So animal-assisted therapy, animal-assisted activities basically provides opportunities for motivational, educational, and or recreational benefits to enhance quality of life. They are delivered, I think I have a call coming in. My apologies for that. They're delivered in a variety of environments by a specially trained professional or paraprofessional and or a volunteer in association with animals that meet specific criteria. Yes, my apologies. I have a call coming in there, but that will go away. Animal-assisted therapy. Again, this definition comes from Pet Partners. So animal-assisted therapy is a goal-directed intervention in which an animal, meeting specific criteria again, is an integral part of a treatment process. It's delivered and or directed by a health or human service provider working within the scope of his or her profession, so just like a social worker. It's designed to promote improvements in human physical, social, emotional, and or cognitive functioning. It is provided in a variety of settings, and it may be group or individual in nature. And finally, again, the process is documented and evaluated. Very important piece there. So we're just going to look at some examples. Under animal-assisted activities, we have things like hospital visits, long-term care facility visits, hospice visits, and these are usually requested by facilities. And this is where the animal-human team are normally members of a specific group, like Pet Partners or St. John Ambulance, or there's another group in Alberta, CHIMO, Animal Assisted Wellness and Learning, just to name a few that are specific to Canada. There are also stress reduction visits, like a human-animal team being present at airports, and I'm sure you've seen some of that, or in a school during exam times. There are at-risk youth visits, such as a team visiting a youth center or a treatment center for youth. Crisis response visits. So an example here can be a dog with a crisis response team being present during a crisis. So that the dog team, then or the handler team, actually help to calm victims and reduce traumatic effects of the crisis. This can actually also be seen as a form of animal-assisted therapy, mainly because it's highly recommended that you have a professional, like a crisis response professional, guiding the work rather than a volunteer. And, of course, you have your workplace wellness visits, so a human-animal team visiting a workplace. So for our animal-assisted therapy, so of course, as you can see, you've got your professional working within the scope of their practice. So you have your occupational therapist who could engage a child in fine motor development by having them, cut up treats for the therapy dog. Physical therapy could be a patient who suffered a stroke, and the physiotherapist is helping with them throwing a ball with the therapy dog, for the therapy dog. Counseling, such as equine-assisted psychotherapy with an individual who suffers from addictions or post-traumatic stress disorder. Of course, our favorite profession, our social workers. An example here could be the social worker who's trying to expedite the therapeutic relationship with their therapy dog present, or they're assisting a family with the use of metaphors in a session. And speech therapy, where the therapist may work with vocalizations with the patient by having the patient direct the therapy dog to verbally to complete a trick or a command, certain things like that. So I'm hoping that those examples kind of allow you to better understand the differences between animal-assisted activities and animal-assisted therapy. So let's take a little bit of a closer look at animal-assisted therapy. So generally, animal-assisted therapy programs are going to be ongoing, and of course that's in order for us to reach goals. Although some goals can actually be reached in a single session, and of course that's depending on your primary modality here. Measurements, of course, you're going to be needing to look at growth or lack of growth over your baseline data. So you need to measure whether or not this is actually beneficial for your client. Of course, it needs to be documented because, as we know, if it's not documented, then it just didn't happen. And, of course, they need to be delivered or directed by a professional working with an animal or the animal handler team to meet the specific needs of the specific client. So, our therapeutic approaches. We're looking at theory here now. So animal-assisted therapy is considered complementary therapy to the primary therapeutic modality being used in the session or with that specific client. So here are actually some primary treatment modalities that work well with animal-assisted therapy. I'm not going to give examples of each of these, but I will give you a couple examples actually. In relation to cognitive behavioral therapy, so we had a youth at our barn who was working on some specific goals relating to her anxiety. It was near the end of one of our sessions when our lovely senior mare, Ginger, who we don't use very often, but she was actually in her stall, so it was perfect situation here. But she decided she wanted her dinner. So Ginger begins banging on her stall door. And of course, as soon as she started doing this, I kind of thought to myself, what a great opportunity here. So I asked the client, what's going on with Ginger here? Let's break it all down. Let's break down Ginger's thoughts, what her feelings are. And of course, we know what her behavior is. So we broke it all down, through her thoughts. So, Ginger could be thinking, I'm really hungry. If I don't eat, I'm going to die, which is what she was probably thinking. And then we looked at her feelings. She was feeling, I'm very angry right now because no one's feeding me. And then, of course, to her behavior. As I said, she's banging on the stall door. Then we started looking at reframing some of those thoughts for Ginger. Let's look at different ways Ginger could be looking at this and her thought process. And eventually what we began to do is we began to look at the client's thoughts then in relation to her anxiety. And the client then was better able to do that with the aid of Ginger and Ginger's need for food, which was great. Another example, mindfulness, one of our DBT skills. We do at the barn what we call mindful breathing with the horse as a part of a grooming session. It's a big part of our mindfulness work. And basically what we do is the client actually grooms the horse, and that's part of the bonding piece. And then at the end, when the horse is all nice and clean, the client will engage in hugging the horse. So, and what they do then is they'll watch the horse's belly, and they'll start breathing in unison with the horse by watching their belly. This, of course, then turns into the client actually practicing diaphragmic breathing or belly breathing. So what's critical here, of course, is that clinicians must know the therapeutic modalities that they're using prior to incorporating animals, because animals are definitely going to add certain complications to that process. Clinicians, of course, should always consider the various life stages as well of psychosocial development of the client, and then reflect on how the application of animals may be actually appropriate for that life stage. This is something that I've had to do on many occasions because I've had many different individuals from different life stages in practice. And of course, I've frequently utilized Erik Erikson's stages of psychosocial development for that piece. Of course, having an animal or animals in sessions means the clinician has to split their attention between the client and the therapy animal. Of course, this is also dependent on what delivery approach you're going to incorporate as well. So as an example, I use the diamond approach with my equine work, which means I have 4 members to the team. So we have our clients, or a client as being the first one, the horse or horses, number 2. I have my equine specialist, the stable manager for Adventure Stables, and then I have myself. So that's our 4 team members. And so, of course, I have the equine specialist there focusing on the horse or the horses, depending on the program, which allows me to place more focus on the client and working towards client goals. Whereas at my home office with my dog, I actually use the triangle approach, where I have the client, my dog, and myself as the treatment team, 3 members. So, of course, it's very important from that approach that I'm able to split my attention between my dog and the client from that approach. My dog is actually retired now, but that's what I had to do. So, complementary and adjunct therapy. So I took this from the Newfoundland and Labrador Association of Social Workers Standards of Practice. I just want to focus on Part A here, which of course states that social workers who use complementary or adjunct therapies and techniques in practice must be competent in the use of these modalities and possess the appropriate skills and judgment for their effective use as demonstrated by their education and training. And I just pulled this one from the Alberta College of Social Workers as well. And we look again under Part D, you're going to see that a social worker, when developing competency in a professional service or a technique that is either new to the social worker or new to the profession will engage in ongoing consultation with other social workers or suitable professionals who are knowledgeable in the area. I really like that piece. And will, of course, will seek appropriate education and training in the area. So, what is the reason for pointing out the obvious? Well, as Aubrey Fine, who is one of the leaders in the field of animal-assisted interventions or animal-assisted therapy, he states, animals are going to add certain complications to that therapeutic process. And without appropriate training and education in animal-assisted interventions, the unfortunate can happen, as happened in California. So in December of 2016, the Board of Behavioral Sciences, which is the governing board for social workers in California, they unfortunately had to take disciplinary action against a licensed clinical social worker for the incompetence and gross negligence in the performance of clinical social work with a minor patient, specifically with respect to animal-assisted therapy. I actually have the link below here on the slide to the specific article, so you can read that if interested. But basically what happened was there was a social worker who had been adding animal-assisted therapy in her practice for many, many years. She had a child in her session, and at the end of the session, the child bent over the dog, which was a Burmese mountain dog, and the dog was actually sleeping. Unfortunately, the dog bit the child on the ear, and the child ended up requiring surgery to repair the ear. The social worker, again, unfortunately, was also placed on probation with certain probationary terms and conditions placed on her. So now, as unfortunate as the situation was for the child, for the dog, and for the social worker, the BBC now does require that therapists practicing animal-assisted therapy and counseling, that's what the C stands for, they obtain proper training. And, of course, they also adhere to best practices, of course, and, of course, the consent piece from the patient or the patient's legal representative. This case actually is very, very important for anyone who wishes to practice animal-assisted therapy. First of all, because, number one, it's recognizing animal-assisted therapy as a therapeutic intervention that requires specialized training, which is absolutely phenomenal. But it also provides expectations for what registering bodies actually do deem to be competent practice in animal-assisted therapy. So two very important pieces there. So let's take a look at standards of practice. I have a lot of segues here. So this also includes animal-assisted therapy too as well. But now, unfortunately in Canada, there are no national standards of practice for animal-assisted interventions. So what I did here was I read through several documents from organizations like in the U.S., such as Pet Partners, globally through Animal Assisted Intervention International, and of course information from the Institute for the Human-Animal Connection in Denver, as well as actually a new document actually provided to me by Eileen Bona from Dreamcatchers in Alberta. Eileen is actually actively seeking stakeholders actually right now to begin some national discussions on developing national guidelines of practice here in Canada. I actually have her contact information at the end for those who are interested. So this is what I came up with. I came up with 6 main areas where standards really should be developed and organizations should be guiding their programs by. So those are standards of practice for the animal partner, for the animal handlers, for the professionals, for the participants as well, and again for program administration and risk management. So for our animal partner, again, these are basic standards that I've included from many different organizations, but ones that I feel are extremely important. So some of these will overlap, so keep that in mind. But our 5 freedoms. So 5 freedoms are actually the benchmark of animal welfare, and they were developed by the Farm Animal Welfare Councillor in the United Kingdom. They were conceived for industrial farm environments, but they are very useful to determine how organizations should actually be meeting at least the very basic needs for good welfare. And really and truly, no program should ever fall below these basic needs. And these are, of course, on your screen here, the freedom from hunger or thirst, the freedom from discomfort, freedom from pain, injury, or disease, freedom to express normal behavior, and freedom from fear and distress. So going back to some more standards, we have training of the animals should involve positive reinforcement methods, looking at the positive piece there. The animals should have regular evaluations from an external party, so they should be evaluated by a third party on a regular basis. And they should meet specific requirements. So, one could be the animal having specific temperament, specific behaviors, how they respond to meeting a stranger, response to loud noises, things such as that. You can find example of these requirements. You can find them on like Pet Partners website. The Canadian Kennel Club actually also has a Canine Good Neighbor program, which is available in most provinces, not in Newfoundland and Labrador, unfortunately. St. John Ambulance, though, Therapy Dog Program, they're available here in Newfoundland and Labrador, and they have those as well as one I mentioned earlier, the CHIMO Animal Assisted Wellness and Learning Society in Alberta. So you can have a look at those, and they'll show you the different specific requirements they have for their animals, which are more than likely going to be dogs. But the animals should enjoy the activity and the environment. Boundaries. This basically means not dressing your dog up like in costume. So I know we all enjoy our poochies looking like pumpkins on Halloween. However, we as handlers or professionals are not able to see any calming signals when our therapy dog looks like a pumpkin. Domesticated animals only, so we want to keep wildlife out of this type of interaction. Ongoing veterinarian care, very important. As well as protection from zoonosis. So zoonosis, of course, is the transmission of disease from human to animal or animal to human. So that's for this piece, for the standards of the animal, of course, we're looking at any kind of transmission from the human to the animal. So that's you passing a virus onto your dog or your cat. Now, that is it's actually extremely low for that to happen, but it still has to be considered. I'm actually going to encourage you to watch a recent Facebook Live feed that Pet Partners had on zoonosis, which is very beneficial, especially in our current environment. They actually on their website now have a piece in relation to COVID-19 on their webpage, so it'd be worth your while to look at that as well. And their website is petpartners.org. So, some standards of practice for our animal handler. So, your handler has to have an in-depth knowledge of the therapy animal as well as the specific breed they're working with, and they need to be able to understand the animal's language. You are the human voice for your animal partner, so please, please, please use it very, very well. Training and handling. So, you should have training that involves how to properly handle your animal, something like a handler course or an obedience training, things such as that. Education in the human-animal bond and experience with that specific animal. Relationship with the animal that's predictable and ongoing. So you and your handler have to have that peace with your animal. The health and well-being of the animal must be priority. So this is in respect to things like grooming requirements, basic health and care needs. Something else that's really important is our length of sessions here. It's always recommended that sessions should never go over 60 minutes, with at least 30 minutes break in between sessions. And this, of course, is needed to reduce stress. And your animal really, really should not be expected to do this all day. So that's important as well. Professional conduct for the handler, very important. And liability insurance, of course, that might be covered under the organization, but you as a handler need to make sure that you have your own if the organization is not covering it. So for your professionals, so this is our social workers. So of course, if you're both the handler and the professional, you need to follow the standards of practice for the handler. So you're performing both roles there. So you need your assessment process. You need to determine if your client is actually a good candidate for animal-assisted therapy. You can actually get some of these assessments online that have already been created, or you can create your own. Please just ensure that you are looking at everything that's there, like your screening process, looking for contraindications, whether or not your client actually wants or desires to work with animals, if there's any abuse of animals in their past, different things like that. Informed consent. So please ensure your client is aware and understands that including an animal into the treatment process can complicate the treatment process somewhat. So make sure your client is well informed of the risks involved prior to incorporating the animal. Mentoring and supervision. I actually really love this piece. Mentoring and supervision, we as social workers do consult, with many other professionals. And because this is a relatively, new field in Canada, I know it's been ongoing for some time, but, we're not regulated enough or anything like that. So, it's relatively new. But having an expert to consult with or to supervise you as you begin adding animals to your practice really should be a requirement. Your goals. You should be working with your client on specific goals and the measurements of growth, of course, or lack thereof of growth. There may not be any growth involved. And documentation again, so keeping clear records of your activities, the response by the client, and all those measurements included as well. So your participants, are they suitable? Will adding an animal partner benefit the participant? Will it benefit the animal? Will you have a true human-animal bond in that process? Informed consent, again. Contraindications, allergies. Do your clients have allergies? Are they, immune? Do they have any immune suppressions? Phobias? Cultural sensitivities. Some cultures have different standards towards specific animals. And safety measures. You get your client information, emergency information, hand hygiene, very, very important. And very important of them understanding animal language. So they're going to need to know some of that in sessions as well. So for your program, for your administrators, you're going to have your policies and procedures for the program. What are they? Develop them. Make them sound advice for your program. Code of ethics, always important inclusion. Yeah. For example, the association I'm with, EGALA, the Equine Assisted Growth and Learning Association, they have their own code of ethics. So, you can create these for your program. Bill of rights for your therapy team, especially the animal. Here I actually have an example of a great document by Anne Howie, who is a licensed clinical social worker. She's a dog trainer and author as well. But she created the Therapy Dog Bill of Rights, and I've included a link there. You can utilize these Bill of Rights for your organization, or create your own and have it visible for visitors and clients to see. Most importantly, though, if you're going to have them up there, ensure that these rights are followed, most importantly. You want your safe working environment. You want for your clients and your therapy animal team. Cost, caring for animals can be costly, so make sure you have a good, solid budget. Confidentiality is a huge must, of course, and ensuring your teams have ongoing training and education in the human-animal bond with focus on human-animal language and handling and obedience. Those are important factors. And again, insurance is there as well. So this is a shameless plug for my boy here. This is Louie, as he minimizes the risk to his eyes during his laser therapy treatment. We're looking at risk management. So you need veterinarian care, ongoing care and treatment for your animal. Immunizations, make sure they're up to date. Hygiene for the animal partner and the animal handler as well, right? You need to make sure that's in place. Hand hygiene is very, very important. Wash your hands. Animal and handler health, of course, if you're not feeling well, if your animal's not well, you should not be engaging in sessions. A barrier use to reduce zoonosis. So if you have a small animal like a cat or a rabbit, that's to prevent scratches. So you put a barrier like a towel or something on the patient before you put the cat or the rabbit down. And let's face it, if there's going to be a transfer of germs and bugs from the animal to the human, the animal's paws are a perfect place to find those germs and bugs. So zoonosis, kind of had a little bit of talk on that. So you're looking at the transmission of disease. Grooming can mitigate some of that stuff, looking for skin problems or ticks on your animal. Animal hygiene, disposal of feces, making sure you have water or food for your animal. And please, please, please don't let them drink from the toilet. And insurance coverage, again, for protection, as well as raw meat diet. Now, this is actually relatively new. I think it was actually 2012 or 2013 that Pet Partners brought this aspect of risk management into practice. And it is because of the transfer of things like salmonella, of course, which can be found in raw meat. But again, then, raw meat diet can be the healthier option for your animal, or maybe it's the only option for your animal. So, your organization needs to review all the appropriate information here and get expert advice on this piece. So here we are. We've got a good bit of information now, general information on animal-assisted interventions, some more detailed stuff on animal-assisted therapy. Now, so you might be sitting there now wondering, how do I start out? How do I determine, what type of animal-assisted therapy program I'd like to be involved in, or what type of program do I want to start? What type of animal do I want to work with? What are my options out there? So one of the ways to determine this is actually to look at risks. Key factors being, what's the risk to the participant, or what's the risk to the animal. So this slide here actually will give you an idea of the risk involved in specific types of programs. So as you can see, the lowest amount of risk is for both the participant and the animal is your observational type of program to your left. That would be the lowest risk for both. And then on the other end, on your right-hand side, of course, is the potential for the highest risk, which is with a resident program. This is actually where the animal lives at the facility, like a long-term care facility, or spends a good portion of the day there at the facility. That would be the highest risk for both the participant and the animal, or specific animals. And really and truly, it kind of depends on the species of animal here too as well, so depending on the risks placed on them. This slide actually comes from my studies at the Institute for the Human-Animal Connection as well. So observational, let's look at all these in more detail. So at the lowest end of the risk spectrum, it includes things like nature walks, going to a wildlife sanctuary, or going to a zoo, or even just watching videos, right? So there's no direct contact between the client and the animal. It's actually a great way to begin as an entry point for clients and new practitioners. This is where you can start practicing your new skills, developing those metaphors, using analogies, different things like that, practicing your link with your primary modality. It is for clients who are not appropriate for direct contact, so you're looking at your high-risk clients. The benefit of this, of course, is there's no species restrictions, and you don't necessarily need to have any experience with the animal that you're observing. Next, of course, we have partial barrier, so that's the next level up on the risk spectrum. And this is where you do have some direct contact between the client and the animal, but they're separated by either a fence or a wire cage or a stall door, like I mentioned in my example with Ginger, our mare, in the barn. The stall, she was in her stall, and the client and myself were outside the stall doing the cognitive work. So it's low risk, but, injuries are still possible. Ginger is an old mare, and she can bite, especially when she's hungry. That's why we don't use her a lot in sessions. But it is appropriate for a wide variety of clients and populations. Of course, it also can be dependent on where they are in the treatment process as well, what their motor skills are, what their ability is to follow directions, things such as that. Suitable species here do include your farm animals, livestock, pets, small rodents, rabbits, different things like that can be separated by a stall or a cage. Just make sure, actually, that the environment that the animals are in actually meet appropriate animal welfare practices. So that's really important. Go out and visit the establishment prior to bringing your client there, and make sure the environment meets standards of care for the animal and the animal's welfare. So then we have hands-on. So hands-on animal-assisted interactions. These are the vast majority of programs out there today. So here the client interacts directly with the animal, which is under the physical control of the handler. So remember that. So the animal is attached to the handler or the professional. Low to moderate risk of injury here to the animal or the handler or the professional. But it's appropriate for clients who can follow direction, basic directions, and they have the ability to regulate their emotions. So this is obviously going to exclude anyone who's actively experiencing a psychosis. So, you have to be aware that some animals can actually sense that in a person. Also not appropriate for anyone who's actively using substances, as well as those with a history of animal abuse. So some exclusions there. Again, low to moderate risk. Only domesticated animals should be involved, so no wildlife. The animal should be well trained and be able to follow commands. So specific animals, of course, here include your dogs, your horses, your cats, rodents. Rats actually make phenomenal therapy animals. They're basically like really, really tiny dogs. And, of course, your farm animals, your pigs, your goats, your llamas, different things like that. So next we have your client in control. So we're moving up the risk spectrum now. We've got more risk involved in this one. Because this is where your client basically has direct access to the animals that are not under any kind of physical control of the handler. This is where, programs such like AGALA, the Equine Assisted Growth and Learning Association, where the client is in the arena loose with horses. Another example could be a dog that's in an area with a client off-leash, or in an office setting with the client off-leash. A cat off-leash in an office setting or in group interactions, or friendly little rats, who are in a group setting learning agility or something like that, programs much like that. There is moderate to high risk because it may take a few minutes for the handler to respond to an incident. So, the animal should be highly reliable to verbal commands. That's one of the most important things here. Types of animals, it depends on how well trained they are, and how well they're trained to voice commands or how quickly you can intervene. Also dependent here on how well your client actually follows instructions when it comes to the client. And finally, we have our resident interaction. So this is the highest risk to the client and the animal. And dependent, of course, on specific animals, it can be the highest likelihood of poor animal welfare because the animal and client, they may actually have interactions that are not supervised by the handler. Basically means that the animal lives full time at an agency or a facility, and they may spend the majority of their day there at the facility. So it could be the family pet of an employee that spends the day at the facility when the owner's working there, something like that. They also may have access to roam the facility at will, such as cats. Some cats do that. Suitable animals here are your farm animals, fish, rodents, and cats. Now, these animals should have a regular routine, and if you're looking at farm animals, there should be a farm manager. They also need a person that's reliable to care for them. When you're looking at fish, they need appropriate care. There has to be an agency commitment to care for the tank and the well-being of the fish. Rodents, a bit of a gray area because they do need supervision. Many, of course, again, are nocturnal as well, and this is like your rats and your gerbils and different things like that. So any kind of program that you're going to do with a nocturnal animal, you're going to need to make adjustments for that. Cats. So our kitties, they tend to be very socially independent and very great at setting personal boundaries. However, they're going to bond with specific people. That's a must. They're going to do that. And allergies, of course, are going to be an issue as well. They also need a specific caretaker, so keep that in mind. So just throwing this in here. So animals that are actually less suited for resident programs, I don't have a slide on this, but I thought it was important to talk about. Some of those animals are your birds, your rabbits, and your dogs. So birds, I know, you see them in many residential environments. Unfortunately, birds are extremely susceptible to stress. Plus, they're not going to display any signs of illness or injury until it's far too late. And that's actually a defense mechanism for them in the wild. They need emotional and mental stimulation, and they need exercise. They have wings, right? So being restricted to a cage with no opportunity for flight is not biologically ethical for that bird. Also, sometimes a busy lobby is very stressful for them. So really, really, truly, please look into the proper welfare for birds before you purchase one for your lobby at a facility. Rabbits. So confinement, number one, completely inappropriate. These wire cages with wire flooring, not enriching to the rabbit. They cannot express natural behavior in a wire cage. Rabbits need to hop, they need to run, they need to burrow. That's what they do. And a few minutes, just a few times a week is just not adequate. So they're highly prone to stress as well. Keep that in mind. And finally, our dogs. So the number one reason why dogs are not suitable for resident living is because dogs have very complex behavioral and social attachment needs, okay? Dogs also, of course, they need social interaction with other dogs. They're pack animals. They also need a consistent and reliable handler and training. They don't understand when their person quits or retires. They also don't understand the steady flow of residents from patients being discharged or releases at an institute or even death, at an institution. dogs attuned to, human emotions, and subjecting them to many different emotions all day is very, very stressful. They don't understand staff time off or staff turnover, and dogs, unfortunately, are held accountable for natural behaviors such as growling, which is actually their warning sign. Plus, dogs should not be asked to work any more than 60 minutes. We talked about that in our standards of practice. So when you're doing therapy work, again, you're looking at 8-hour shifts, 12-hour shifts. This is completely unethical for dogs, right? So please think twice when you're looking at obtaining a dog for your facility. Now, there are some exceptions to this, and I know that because I know there are some fabulous programs out there where a clinician will, bring their therapy dog to work with them, and that dog is a part of the therapy with that professional throughout the day. I actually went to school with one such person who's a social worker in California. She developed a fantastic program for her dog, Charles, and the organization she works with. So Charles, number one, is her dog. He goes to work with her every day. He returns home with her at night. She's the owner, the handler, and the clinician all in one. That reduces and minimizes the stress for him. She put so much ethical considerations in place, but not only for Charles. Charles actually has his own office. He has a playpen next to Rachel in her office. But also for the clients at the organization. She looked into the informed consent piece right at the entrance of the facility. So there's a sign there with Charles there, and informing people on him and the program that they have at the facility. As well as for the staff and visitors, all kinds of ethical considerations put in there. They actually installed a call system at the entrance for those who have fears or allergies, so that they have then time to put measures in place to before that person enters the building. So it is possibly ethical. It's highly possible to be ethically responsible and to lower the risk with a dog at an organization. You just need the education, you need the knowledge and the experience, and of course your organization. That you need an organization that's willing and able to support that program. So one of the topics I've mentioned several times here now. I know we're getting short on time, but I really want to get this out, is in relation to understanding your animal's language. So what I thought I would do here for the last few minutes is to focus on the dog and the dog body language and stress. So dogs are probably the most common animal partner involved in animal-assisted interventions, dogs and horses actually. However, dog language is often overlooked, primarily because humans often give human characteristics to our dogs, which is what's called anthropomorphism, such as dressing your dog up like a pumpkin, or the ones I've seen recently on Instagram where dogs are dressed and painted in Renaissance costume, made to look like generals or admirals, different things like that. So one of the animal welfare issues with anthropomorphism is when humans think dogs share our language and our thoughts, essentially. But they don't. They do not share a language, far from it, actually. And as I've already noted, dogs tend to be held accountable for their language, which is completely unfortunate. So I'm going to be showing you a video, and you're going to be looking at some dog language here in this video, and it's called "Does Your Dog Really Want to Be Petted?" So pay attention. There are 2 dogs in the video, and I want you to really pay attention because I'm going to be asking you if you understand their body language.
Does your dog really want to be petted? We humans almost always want to touch dogs, but not all dogs want to be touched, even very friendly ones. One way to tell if a dog is enjoying something is to stop the activity, then see if they try to restart it. This is sometimes called a consent test. It's a way to help a dog communicate with us about what they like or don't like. Here's how to use the consent test to ask your dog if she wants to be petted. Sometime when your dog is relaxed, set up somewhere comfortable with her. Don't have her on leash. And don't block her somewhere where she can't get away. Pet her wherever you think she would like it best. Chest is usually good. Then take your hand away.
Now, what do you think? Do you think Zany wants to be petted? Question for you guys. So you looked at her behavior. What are you thinking? Does she want to be petted or doesn't she? Okay. Hopefully you've got your answers in there. Let's see what your answers are. So 66.7% of you think, yeah, Zany definitely wants to be petted. And we've got 33% that think no. They're seeing some signs there that Zany's saying no. So let's see what Zany is saying.
Zany says no. She actually says no many times in dog body language. In 27 seconds, she did 4 lip licks, 7 head turns away, 2 full body turns away, and 2 shrinking back. All of these are typical signs of stress or avoidance. Here's a lip lick. Head turn. Full body turn away. Shrinking back from hand. This is pretty clear communication once we get a good look at it. Zany could have left, but she stayed, probably because she anticipated that what we were doing might turn into a training session. Here's a different dog. Summer says yes. And yes. And yes again. Summer leaned into me. Her eyes were half shut. Her facial muscles were relaxed. She walked up to my hand whenever I stopped. This is clear communication too. We can learn to read dog signals and let them have a voice in what's going on. How does your dog answer the question? Thanks for watching. Zany got spray cheese for being such a good sport.
So, I've actually owned dogs and had dogs in my life for over 50 years. I even volunteered and was an executive for a local dog rescue group, Beagle Paws. So there were times I had many, many dogs in my home, either fostering them or they were visiting, or when I rented an apartment, I had tenants with dogs. And I, too, actually thought Zany wanted to be petted. However, when you see Summer's language, it does become more clear than ever that Zany really did not want to be petted. So I'm going to encourage you actually to do this consent test with your dog, if you have one, to ensure you're actually listening to what your dog is saying. I do it all the time now, actually, and as much as I want to pet my little old man when he tells me no, I will listen now, as difficult as it may be sometimes. So this information here comes from Turid Ragas, and I strongly encourage you to watch some of her videos in relation to calming signals. Also, go to a dog park, very, very interesting actually, without your dog. Just sit in your car and observe the language dogs have with one another, because that is also language that they're going to have with us. So some of the calming language are calming signals, and they're actually used to in situations like to keep the peace, to be friendly, or to avoid conflict, or even cut off conflict before it starts. But there are also warning or threatening signals, showing teeth, growling. I see these videos on social media now with dogs showing teeth, and the caption will read how the dog is smiling. Well, I'm sorry, but your dog is not smiling. He's actually perceiving a threat, and he's giving you a warning. And he's doing this, you need to know these signals before you start your therapy work. So Turad states that, it's extremely important to be able to communicate with your therapy dog. Dogs, of course, live in a world of sensory input, visual, what they see, olfactory, what they're smelling, which is a huge one, and auditory, what they hear. There are at least 30 recognized calming signals for dogs. Some dogs have an incredibly rich vocabulary, while others, like my old guy, only have a few. And it varies from dog to dog. These signals are international and universal, so a dog in Japan or South America would clearly be able to communicate with my dog here in Newfoundland, Labrador, Canada. The most important piece here is, of course, that we need to understand the language of dogs so that we can understand what they're telling us. So here are some examples. So we've got our yawning. As an example, my dog uses this all the time. He does it when he's anticipating a walk, when he's excited. He'll do it actually as well when my husband and I quarrel sometimes, so showing his dislike for our communication with one another. Licking, another one my dog uses. He does it sometimes actually in combination with yawning. And when I see the licking in combination with the yawn, I'll be more observant of the environment and what's happening and what's going on, because he's clearly telling me something is bothering him. Then we have panting. So if your dog is panting and it's not in relation to exercise or heat, clear communication of stress for most dogs. But it also could be a sign of trauma as well, so keep that in mind as well. Whale eyes. So this is actually a warning signal. So this is where you see the whites of the dog's eyes. Please keep this one fresh in your mind. If you see it in your dog, it's clear communication of a threat, and your dog is warning you or the threat, which could potentially be your client, and it could lead to a bite. Turning the head or turning away, very common signal with dogs, especially when they greet one another, and greeting humans as well. So you're definitely going to start noticing this behavior now that you're more aware of it, which is great. When I do some training actually with my dog, which I still do even though he's 11 and no longer a therapy dog, actually he's retired now. But when he begins to turn his head away from me and the focus is no longer on me, I know it's time for the session to stop, because that's his language telling me he doesn't want to be at this anymore, right? Flattening of the ears. Your dog could actually do this when they're feeling submissive or anxious or afraid, so watch for the language and the events happening to help translate that language. Lowering of the tail. So your dog's tail can tell you so much. Study it, read about it, what the language could possibly mean, and then observe your dog's tail to determine what's going on. Even little stubby tails have language. And lowering of the body. And this dog in the picture actually with the lowered body also has whale eyes. So again, more of a threatening or warning signal, especially in that combination. And the dog looks like he's perceiving a threat there. So now we're at our final topic. And this is on understanding stress in your dog or your therapy dog. So this information again comes from my studies at the University of Denver. And it's in relation to trigger stacking. So what is trigger stacking? Well, trigger stacking occurs when small stressors occur throughout the day, and if they're not dealt with, you actually eventually get to the point whereby a seemingly small, little, insignificant event can actually lead to the straw that broke the camel's back, basically. And this happens with dogs as well. I'm sure you have heard people who have been bitten by a dog say sometimes, that the dog is just a saucy dog or a mean dog, or all I did was pet the dog and he bit me, or the dog growled at me for no reason. Well, spoon theory is actually a good way to visualize this concept. So this was actually developed by a lady by the name of Christine Miserandino to explain the chronic pain of fibromyalgia. So Ms. Miserandino was actually eating lunch with a friend one day at a restaurant, and her friend asked her what it was like to live with chronic pain. So Ms. Miserandino grabs a bunch of spoons from the tables nearby, and she says that, basically everyone wakes up each day with a certain amount of spoons. So genetically, you may start the day with many, many spoons, but when you're sick or you're in pain, you lose a bunch of spoons right from the beginning of the day. And then you've got fewer to get through your day. So then as the day progresses, little things happen, like waking up late, sleeping in, you miss the bus, have an argument with your coworker or your spouse, and these are going to cost you a spoon here and there. So stress reduction techniques are going to regenerate some of those spoons, like things like a good night's sleep, or breathing techniques, yoga, meditation, exercise, different things like that. However, sometimes things may be so tough, that you may have to borrow spoons from tomorrow's supply. So spoon theory has actually been appropriated by dog trainers to help owners understand events and experiences that may take away from your dog's ability to behave or learn. For our therapy dogs, it's critically important for therapists and or handlers to understand the ethical inclusion of dogs in therapy sessions. So this is what spoon theory does. So just to get a quick example of my dog, Louie. So Louie is actually a German Shorthair Pointer. So genetically, he's a high-energy dog. He's like the Olympic athlete of sporting dogs. And when he wakes up, he's ready to conquer the world. He's a bucket full of spoons ready to get through that day. However, he's 11 years old now, so that takes away a whole lot of spoons right before he even wakes up. He's also got a chronic injury to his knee, so maybe he goes out and he tweaks his knee while using the bathroom that morning. More spoons are taken away. Then later that day, we have our vet appointment for his laser therapy. Even though he doesn't mind going to the vet, there are different smells there, different encounters with other animals that can be so stressful for him. So more spoons are taken away. So what started out as a bucket full of spoons is now down to just a few spoons, or maybe they're all gone. I don't know. So when he was working with me, if I knew we were down to a few spoons, I would either not bring him into a therapy session, or I would let him rest for a while, or take him for a swim, which he loves, and then I'd reassess his spoons. Because I know that if he uses up those spoons for the day, and he takes some from tomorrow's supply, I know that he can hit his limit. He has a breaking point. All animals do, and I don't want that to happen. And I'm going to caution each and every one of you out there that will say, oh, my dog's never going to bite. He'll never bite. Well, unfortunately, that is not 100% accurate, because if they reach their breaking point and they have no spoons left when they're faced with another stressor or a threat, they can and they will bite. So now we're going to look at the worst case scenario for spoon theory. I'm not going to show this video, but if you do plan to work with dogs in practice, I really feel that it's important for you to view this as something you really need to watch. The video shows a dog actually biting a TV news anchor live on TV. You do see the bite, but you don't see any blood or gory details or anything like that. And the owner actually restrains the dog very quickly. So it's not as bad as you may think. But something you're going to see, though, when you watch this is you're going to see the dog's flight or fight response in action, right? Basically, he can't get away from the situation, so what he does is he fights, which is biting. Now, Max's breed, he's a Dogo Argentine. That's the breed he is. And they're actually bred for big game hunting. They're also used for search and rescue. They're used for police assistance, service dogs, guides for the blind, competitive obedience and military work, something like that. So they're very intelligent and very, very courageous dogs. But let's look at what you don't see. When you watch that video, there's lots going on there with Max. Let's look at what his spoons look like. So what were Max's triggers 24 hours before that tragic bite? Well, he actually fell through a frozen pond. He was out with his owner, he ran after a coyote, and he fell through an icy pond. And he was in that pond for a while before he was pulled to safety by firefighters, of course, who were dressed in very unfamiliar gear. And did he bite them? No, he didn't. He pulled the rescue fine. He had to go to the vet for an emergency examination. I don't know about you guys, but I can hear the spoons being pulled away a lot here. His owner had to be under stress. Max felt that. More spoons gone. Then the next day, although he did have a bit of a sleep, but we're talking about the tragic situation here, right? But the next day he's brought into a TV news studio. So that's all this strange environment with light, sound, heat, activity. He is in close proximity to his owner, which is a resource. However, his owner is restraining him by the collar. The TV news anchor, God bless her, as we say here in Newfoundland and Labrador, but she did really mean well, but she was completely inappropriate with her handling of Max. She's holding his face, she's staring at him, she's got her hand over the top of his head, she's patting him very strongly on the back. There is an actual follow-up interview, actually, you can see with her as well, if you're going to watch that video. But Max gives off multiple calming signals, and all of them are ignored. And that's where he runs out of spoons. He can't get away. You can actually see we're at one point where he tries to get away. So he can't get away. She bends down to give him a kiss, and he fights, and he bites her. So before you bring your therapy dog into a session, or if you're doing animal-assisted activities even, before you bring that dog into a visit, please assess their spoons. So that's the last bit. However, you can learn so much more if you take a course in animals and human health, animal-assisted interventions, or animal-assisted therapy, something like that. Finally, though, for our ethical considerations, there's always going to be some risk for animal-assisted interventions, unless it's observational sessions like we mentioned a bit earlier. There's always going to be stress involved, but problems are going to arise through the lack of awareness and us being reactive instead of proactive. Safety planning and problem solving ahead of time is so, so important. And finally, it's all about balance, the balance in your animals, your handlers, and the setting and the clients, okay? It's certainly not about perfection. I threw in some resources here for you guys. Lots of information there on, these are some of the texts that I've used myself for study and for general knowledge. Lots of them there that you can print these off. Inside of a Dog, great book by Alexander Horowitz. If you want to get some education and training, here in Canada, we have Dream Catchers in Alberta. They're Animal Assisted Wellness Academy. The website is there. And this is the lady, Eileen Bona, who is developing the national standards for practice in Canada. Lakeland College in Alberta as well as the dog shop in Quebec. And I spoke with Gabby at the dog shop on one occasion. Very, very nice lady as well. In the United States, we have the Institute for the Human-Animal Connection through their School of Social Work. You'll see that these are more so like in line of different schools of thought. I attended the University of Denver for that reason because it was through their School of Social Work. The Center for the Human-Animal Connection through their School of Nursing. Texas State University through their College of Education with their Animal Assisted Counseling Academy. The Academy, sorry. But I have a link here below as well for many, many more listings for programs through the United States because they are much more ahead of our situation here in Canada. So that's it. And these are just some of my animal partners. This is Louis up in the corner with his birds book. That picture actually is being utilized in New York State for a reading specialist. She uses that picture a lot in her program, and some of the horses at the barn. And my contact information there as well. Please go to my Facebook page and like it because I do normally put a lot of information on that page as well. So that's it. We ran over a lot. Sorry about that.
Oh, no, that was wonderful. My goodness, Lisa, such an interesting topic. So we still do have a few minutes for question and answer, so we'll certainly do our best to get to those questions. We did have a few come in during the webinar, so if others have questions, they can certainly send them along. One of the first questions we received was at the beginning of your presentation in terms of what parts of Canada are using this professionally and is it recognized? And you addressed some of that in your presentation, but did you want to speak more to that?
Yeah, I guess it depends on the professional. In regard to animal-assisted therapy specifically, there are some programs out west that are more developed, obviously, and in Ontario. You'd have to search them online, but for animal-assisted activities such as dogs visiting hospitals and different things like that, look for your organizations that assess your dogs for suitability. So for here in Newfoundland and Labrador, we have St. John Ambulance only, but you can look up those different types of organizations, and there's as well more out on the West Coast. For animal-assisted therapy, it really is dependent on the therapist themselves. There is no any kind of certification process, unfortunately. That's why it's extremely important that you know your animal's body language and your ability to split the time, as I mentioned before. And it depends on the organization. So if you're working for a specific organization, like a health board or different things like that, you can bring forward your education and training and say, I can probably utilize this piece in a therapy session with a client. and follow what your organization suggests and requires.
Okay, perfect. Thank you. Someone's asking if there are any courses specifically that you would suggest one would take if they would like to get involved more with animal-assisted interventions.
Portions, I guess, as in training?
Yes, courses, yeah, and training.
Oh, courses. Sorry, I thought you said portions. Courses, yeah, absolutely. In Canada, you've got your dream catchers in Alberta. Contact them, have a chat with them. When I did my training, I kind of looked at what lens I wanted to look through, but I also wanted, which was social work, obviously. But dream catchers, they have the ability to work with that lens as well. So, but I also wanted to ensure that I was getting the information that I looked at. So I went through all the programs out there. I mean, it was a long task that took me to kind of get into the bones of what program I wanted to take. But there are also courses out there that you can do. Sometimes you can audit courses at a veterinarian college that looks at animal behavior, because animal behavior is probably one of the biggest aspects of this. One of the biggest reasons why I don't work with horses alone, and I have an equine specialist there, is because I'm not that familiar with horses. I mean, I do know some of their language, but I'm not as familiar as my equine specialist is. She's been working with animals for over 50 years, so she certainly knows their language. So any course out there that's going to focus on animal language, your calming signals, different things like that, those are the courses that you want to do. You always want to have some kind of a practical component as well. So, I actually went to the University of Denver for a course as well, so you want to have that practical component embedded in that as well, because it's great to look at videos and read things and things like that, but the practical piece is where you're getting a lot of that knowledge.
Mm-hmm. Okay, excellent. Thank you. Someone else is writing, they give a specific name of a dog, of a Chesapeake Bay Terrier, who shows its teeth while wagging its tail. The owner says that the dog is smiling. Have you heard of this, or is this some kind of signal that the dog is giving?
Normally, if a dog is showing their teeth, normally, I will say, it's a warning sign. However, sometimes when, we have the ability to train dogs to do certain things. So I don't know if this person is actually training their dog to do it. Maybe they did it subconsciously. Who knows? It thought it was cute, and then now they're training the dog to do it. Or the dog is automatically doing it because he was rewarded. So there's different things like that. But initially, if a dog is smiling or growling, is what the actual piece is, or showing their teeth is a warning sign. If they're doing it, their language it's a warning sign. But again, as we as humans, we have the ability to adapt certain behaviors to make them less warning, and the dog will respond to that. So, and again, I'm not any specialist in specific breeds or anything like that. All I can say is that for dog body language, when a dog shows its teeth, it will normally be a warning sign.
Okay, perfect. Thank you. Another question we have is, could you give an example of an intervention that you would use in session with a dog or a horse?
Okay, well, I gave the example with the horses at the burn. We do a bunch of things. We use the Agala model as well, which is a specific model that utilizes metaphors in session. So the horse could represent something for the client, or different things like that. We actually had a client at our burn that, in utilizing the Agala model, which is not specifically recognized at this point as a primary modality, but we did have a client there that was working through some addictions, and that person had a lot of anxiety that day at the burn. And we had two horses in the arena with him, and two of the horses started galloping around a lot. Of course, our equine specialist immediately came in for safety reasons, but we asked the client what was going on with the horses, and of course his response was, they're basically representing how I feel inside. So then, of course, that gave us the ability to then work with that person to say, okay, well, let's talk about that some more. What is going on inside? What he was representing on the outside was not what was going on the inside. So that's part of the Agala model, something like that. for my dog, I actually had a young person who had a lot of self-control issues. So what I got the client to do with my dog, and of course, again, my dog is a very hyperactive dog, very energy like galore. So what I got him to do was to train my dog to become hyper and then stop. It's actually, I think it's called Go Stop Go. I read it somewhere online. I think it was from Reese Van Fleet, actually, in the United States, another trainer. So I did that with my dog, with the patient, or sorry, the client and my dog. So he would teach the dog to become very hyper over a ball or whatever it was, and then he got the dog to stop. So then, of course, we translated that behavior into his own behavior. So then it's like, PD, whatever his name was, just like, so when you get really, really hyper, now you know how to stop, just like Louis does. So different things like that. There's such a wealth of knowledge you can get online with these things too, and courses will teach you all this stuff as well, right?
Yes. Oh, that's excellent. I think we have time for one more question. Someone wants to know, is there one breed of dog that is more adaptable to animal-assisted interventions?
The answer to that is yes and no. So there is a reason, I guess, why, a lot of service dogs, or service dog school will say, and again, service dogs are not included in this form of therapy, again, but when you're looking at specific breeds of dogs, there is a reason why they used a lot of the golden retrievers and the Labrador retrievers and different things like that. And it's because they have a specific temperament that is more, I guess, much more appreciated for this type of work, animal-assisted interventions, that being. However, that does not mean that you can't have a pit bull that's great at therapy work, or a beagle, or any type of those mixed breeds out there. Your SPCA special. There's no reason why they can't be a great therapy dog. I'm actually in the process now of getting a new dog, and I'm at that point where I'm thinking, well, what type of dog do I get? So I have the local SPCA kind of on alert. They know what my plans are. So every time a dog will come in, they'll, I go over, I meet the dog, kind of assess that piece. Doesn't happen very often, which is great for homeless dogs. But I'm also looking at different breeders. So I have looked at many different things. I've looked at, this is a lifetime commitment for me and my family. So I need to determine what type of animal is going to be, or what type of dog is going to be good for my family. Is it going to be a larger breed dog or a smaller dog? What is my Louis going to think of this? I have to take all that into consideration. And again, a lot of these mixed breeds that are mixed with low shedding dogs, like the doodles and different things like that, probably a little bit more appropriate for visiting hospitals and different things such as that, because of their low dander. Believe me, there are no hyperallergenic dogs. Does not exist. Every dog is going to give off something. Even hairless dogs will give off something that someone could be allergic to. So keep that in mind as well. But you really need to do your research on it and kind of look at those breeds. As well, don't take on, let's look at a pit bull, for example. Do not take on a pit bull if you're a first-time dog owner. Please don't do that. Even a large breed dog, like your Burmese mountain dog or anything like that. If you're a first-time dog owner, you're probably better off not getting a big, large breed that's going to need a lot of care and attention. So that's something else you need to look at as well. So many different factors. It's a lifelong journey. So it's one you can't make in haste. You really need to do your research and your talks with your families and your things like that, for sure.
Wow, that was excellent. Thank you so much. And we're just about out of time, so unfortunately we can't get to any other questions, but thank you so much for your questions and comments. I do want to thank Lisa for this wonderful presentation and for sharing her knowledge, experience, and expertise with us today in celebration of Social Work Month 2020. Lisa certainly covered a lot of important information pertaining to animal-assisted interventions in social work practice, including components of the human-animal bond, the theoretical underpinnings, and certainly the ethical considerations and standards that need to be considered. Lisa, this is such an interesting topic, and your passion for the work is certainly evident. So I do thank you for giving so freely of your time and for hosting this national webinar for your social work colleagues. For those who attended 75 minutes or more of the presentation, confirmation of attendance should be now available by clicking the yellow icon at the bottom right of your window. For social workers in Newfoundland and Labrador, this webinar may be claimed as 1.5 CPE credits under the required category of workshops as per the NLASW CPE policy. I also encourage everyone to complete the evaluation that will appear in your screen as well. So on that note, thanks again, everyone. Thanks, Lisa, for a wonderful presentation, and have a fantastic day.
Yes, thank you.